Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the highlights at this hour. Federal government says if the public doesn't take ownership of advocacy, very little can be done to stop the spread of the COVID-19 virus. Safety is the highest priority as aviation authorities say reopening of airports and the start of operations by domestic airlines might not happen on June the 21st. And former epicenter of COVID-19 in the United States, New York City, is to move to the second stage of reopening on Monday. Almost 10 in 10 people in Nigeria know about COVID-19. These people also know about the safety guidelines issued by the Presidential Task Force on COVID-19 and the Nigeria Center for Disease Control, the NCDC. And that's according to the data released by the Federal Ministry of Information. Speaking today in Abuja, the Minister, Alhaji Lai Mohammed, says the challenge of curbing the spread of the virus is convincing Nigerians to take ownership of the advocacy campaign, without which, he says, little will be achieved.
We will continue to deepen our advocacy programs. We continue to enlist the support of all stakeholders. We have gone far beyond just, using the television, radio, or the new media. We've also gone down to social mobilization. And here, this is where the NOA has been very, very active. But we are of the view that until and everybody takes ownership of this pandemic and this advocacy, very little will be done. And this is why we are enlisting the support of national rulers, faith leaders, and opinion leaders to lead and take possession of our campaign. If they don't take possession of this campaign, we will not be able to achieve as much as we want to achieve.
Meanwhile, the tentative date for the reopening of Nigeria's skies for domestic flights, which is Sunday, June the 21st, is no longer feasible, as more work still needs to be done to ensure safety. The Director General of the Nigerian Civil Aviation Authority, the NCAA, said this today at the daily news briefing by the Presidential Task Force on COVID-19 in Abuja.
In addition to the aviation system worried about this transmission of coronavirus, it is a statutory responsibility to ensure that operations are safe and secure. The industry has been grounded for close to 3 months now, and we have to ensure all aircrafts are checked, they're airworthy. All pilots will have to check their proficiency and the residency experience is up to date. We have to ensure that our security at the airports are up to date, and so many other areas. The proposed date, we never said aviation is going to start definitely on the 21st. We are supposed to put our report back. Based on what we have, we'll have some work to do. As such, June 21st is not a feasible date to resume operations domestic. The Civil Aviation Authority, despite all pressures coming from all quarters, will not approve the start of operations any date until we are sure and we confirm that we are ready to start in a safe, secure, organized, and efficient manner. To do otherwise will be disastrous for all of us.
To stem the spread of COVID-19, the Yobe State government, in partnership with Northeast Regional Initiatives, has commenced training of women and youth volunteers who will conduct house-to-house COVID-19 sensitization in insurgency-affected areas. The Commissioner for Health, represented by the Director of Nursing Services in the state, says the targeted women and youth were taught on the causes, signs, symptoms, and prevention of the disease. According to him, the field volunteers are also to report to the local government health authorities any suspected case of the virus. 10,000 households, especially women who are restricted to staying at home due to cultural and religious practice, are being targeted in this exercise.
Sensitization in Gaidam and Yunusari, we are targeting a total of 10,000 households. We are all aware of the religious and cultural background of these communities where we are working, where women are restricted to houses, and as a result, and this is a global issue, and this is pandemic that knows no boundary. So we feel it is necessary for us to also go into house to house so that those women who have not been privileged to go out and get this information can also get the information through the house-to-house sensitization. So we have also given hand sanitizers, face mask to these female volunteers so that as they go into the houses to sensitize the women, they will train these women on how to wash their hands. They will equally teach these women on how to wear face masks. They can equally teach these women on how to use hand sanitizers. And these are all aimed towards ensuring a larger community engagement and risk communication to reach almost everybody at all levels of the community.
From Yobe in the northeast to Ekiti in the southwest, where the government there says it is looking at modalities on reopening places of worship. The committee set up for that purpose has been meeting stakeholders to tighten loose ends and arrive at a conclusion devoid of much risk. Our correspondent, Babajide Agbeyo, tells us more.
Obviously, religious institutions have been itching for the holiday to be over. But the danger of COVID-19 has been calling for caution, and stakeholders have been having series of meetings and interface here to ensure that these modalities are fine-tuned. Some of the religious leaders ventilate their opinions.
We agree that the use of face mask is going to be made compulsory for every worshipper. But one of the things that was proposed last week that I'm still thinking if it's possible for us to change today is the idea of opening the church just for an hour in a week. That is, on Sunday alone, between 10 to 11 or 11 to 12. And it's going to be one service, which is not going to be convenient for the people because we have many Christians. And we propose that we are going to have 3 meters apart to maintain social distancing during the services. But if we can still change that time, I think the major problem I'm having is the idea of 1 hour per week.
We are praying to God to drive this virus away from us because the conditionalities are too technical and difficult to meet. It's very, very difficult. So it's as much as possible. In fact, in my own personal opinion, and most Muslims, we have the opinion that even after submitting a report to government should monitor and see whether all what we claimed to have put in place in our mosques and churches are actually there.
Well, the deliberation continues, and it is expected that the outcome will be the best for safety. Babajide Agbeyo for COVID-19 update.
Okay, the issue of religious places of worship and reopening or not reopening has been a thorny one, both for the federal and state authorities. Across the country, there have been different positions. While some states have reopened and reclosed some of those institutions, there are others who have at the last minute changed their minds, such as Lagos. So what really is the position of religious places of worship? Why are they particularly susceptible to COVID-19 and the possibility of spread. To take a look at this, I'm being joined here in our studio in Lagos by Pastor Laddie Thompson, who is the senior pastor of Living Waters. He's also the special advisor, conflict resolution and matters related to terrorism for CAN, which is the Christian Association of Nigeria. Thank you for coming in. And I see that you have the full gear on you, double protection, shall we say.
The pleasure is mine. Trust me.
All right, let me go to our Kano studios, where we're also being joined by an Islamic cleric, Dr. Ibrahim Elias. Dr. Elias, thank you for your time and thank you for joining us this evening. Okay, let me start with you, Dr. Elias. Given the situation that we have now, some places in parts of the country have reopened places of worship, including mosques and churches. But some have discovered that some of the conditionalities for this are proving a bit more difficult to achieve than were initially thought. What's your own position? What do you think of the issue of reopening of places of worship and the guidelines issued?
Basically, Islam is a pragmatic religion, pragmatic in the sense that it accommodates changes at all times. So the measures so far taken by government to ease worshipping for adherents of this Islamic religion, basically it was to attract them more and to ease their apprehension. So certain measures were put in place, like, for example, ensuring that washing hands, provision of sanitizers, and many more are strictly put in places. So basically, this is one thing that attracts more worshippers to go to their place of worship. And not only that, it also helps them to be more dedicated to their religion and to alleviate their apprehension concerning the rumors that there were some conspiracies related to a banning of congregation in places of worship.
Let me ask you this as well, before I come to Pastor Thompson. Let me ask you this. Earlier on, when the idea was first being contemplated, there were one or two imams who actually lead congregations who said, look, you can't hold us responsible because the congregation is behind us. And therefore, you don't know what exactly is going on when you lead prayers because you're all facing the front. Now, and that for as long as they can't guarantee what is going on, the places of worship should remain shut. Would you agree that that is a pragmatic way of thinking?
Well, I think, in my opinion, this is rather a dogmatic way of expression. Islam, like I said, is compatible to all times and to people of all ages. And for that reason, the teachings of the Quran, for example, if we are to reflect on the teachings in verse 33 in chapter 13, it says that we have to, at all times, be guided by the advice of professionals in any field. And those who are professionals in this field are experts in health sector, medical doctors. So when it comes to religious affairs, you are to consult religious clerics. So, but the person you are referring to, I think he has no sound judgment on thinking of how to engage with people with different opinion. As long as we are talking, there is a way of channeling our opinions appropriately without having to hurt other person's feeling. So I think Islam has various ways of interpretation, but it depends upon the person involved. So I agree with your judgment that the person was somehow dogmatic, but there are many ways of expressing our ideas without having to hurt anyone.
Okay, let me come to Lagos and Pastor Thompson. It would appear as if the divisions, even in terms of the response to this, has been equally much, shall we say, within the Christian fold as well. There were some who expressed very serious disappointment when Lagos State reversed its position a day or two ago. In your own opinion, has this been handled wrongly?
I don't think this has been handled wrongly, and I'll tell you why. For many generations, the entire globe has never had a pandemic of these proportions. And then also you want to remember that when we come to the issue of religion, man by nature is religious. So you find out that the advantage I think we have for the church is this. First of all, what the scriptures guides it says, look, people die for lack of knowledge. So when you come to the Christian faith, there's a very high premium that is put on knowledge. And if you say theologically, you go through church history, one of the greatest advantages we have had is the works of Saint Augustine of Hippo. You remember he was one of the first to help us to build a bridge between faith and reason, between science and religion. So you find out that when the church has to take a decision on matters like this, more so when it's so deadly that it kills, we have to resort back to that platform and weigh what is going on. Now, naturally, a lot of people emotionally love the fellowship, the gathering together. I'm going to say this to you. Number one, in the Christian faith, if you look at our theology properly, it is possible for us to be in different locations and still be in one spirit, in one accord. And I'm talking theologically.
Right.
There. So first of all, that anybody will say it's impossible for anybody to put the church down and halt us, it's impossible. Because we can be in different locations and still gather in one accord in spirit. But the more pragmatic approach that tells us we need to be cautious is this. When this thing first came out, WHO reports, everybody came, it's not airborne, it's airborne. As time progressed, they found out that this pathogen is deadlier than the first had observed. And the matter of fact is that there are three different ways, basically, that this thing spreads. The touch, okay? But that is much less than by speech, the droplets. It's because of speech that they put 6 feet, the social self-distancing for 6 feet. Now, it has now been found out that when you sing, when the choir comes together and the choir sings, it increases to like 10 feet. And in every country where they have tried to come back into church, and of course you know that choral singing is all a part of
services.
Of service. Now they found out that the results were disastrous. When I say disastrous, I mean disastrous because singing actually projects it even further. And this is the fact again. When you are in an enclosure, and in many churches, whether they are air-conditioned or not, and you have a number of hours that you are in there that you have to be together, the chances increase. Now, remember I said there's a bridge between faith and reason. So what I'm talking to you about right now is basically reason. I'll come to the faith. You see? So, based on reason alone, looking at the basic factors, medical factors, the human body, and all that, we realize that if we really want to bring back people together again, church at its best is family. Family church. You don't want to risk anybody's life except you are sure that nobody will contact it. Look, there's no pastor, there's no shepherd who has a heart for God that will permit one person to go home with COVID-19 that will result in anybody's death. More so, families. Now let's come into the level of faith. You see, from the faith perspective, what we're looking at is this. There's a tussle, there's a dynamic between the kingdom of man, the kingdom of darkness, which we believe is the source of a pandemic, and of course the kingdom of God. Now, the kingdom of man has its medical science looking for a vaccine. The kingdom of darkness has donated the pandemic. Right now, when we look into our archives, what the kingdom of God has actually, which has been proven, we're not looking for a vaccine. There's something called the law of the spirit of life in Christ. which has been tested. And I'm going to give you the model that we use. In the early 1900s, in South Africa, there was a pandemic, something similar to it. Millions died. The reason why people are not yet panicking in Nigeria is because something is helping us here, whether it's epigenetic or whatever, so the statistics are not yet as high as the potential that they have to be. Now, when we come back into the faith, when there was a pandemic like that, there was a fellow in particular called John G. Lake, who was well related to the Azusa, which was the beginning of the Pentecostal move. He refused to wear any of this. He didn't need it. All the doctors were kitted. People were dying. He didn't die. He never caught it. And they said, what's your secret? And he said, listen, bring your microscopes, put the pathogens, let them touch my body. Once it touches my body, you'll notice that the pathogens die. Now, the medical doctors, now this is now the bridge that I say between science and religion.
Right.
The doctors conducted all their tests and found out that once the culture, the pathogen touched his body, they died instantly. So they asked him, what's going on? And he says, listen, every sickness and disease based on our faith works based on a law or a principle of sin and death. The cure for it is a law of life, a peculiar life, the law of the Spirit of life in Christ Jesus. So what I'm saying is that the template we have is such that we should be talking to government right now to set up control experiments for us so that we can put our best foot forward from the faith perspective. When we are sure that we can activate in this generation the law of the Spirit of life in Christ, it's not tempting God. A law works. It's like gravity. It's like a law of lift. Once you activate the law of the Spirit of life in Christ, there is no COVID-19 pathogen that can affect you. They die when they touch your environment. So once we can set up control experiments with ourselves, look, Lagos State, for instance, I think should be the first to set this up with us. The current president has spoken based on, like I said, the position of St. Augustine.
Right.
However, if we want to move forward and be a blessing to the nation, and especially for those who insist that we have to open church, we need to set up these same controls for us to be sure that none of the flock, nobody is going to come and contact something that will bring shame, sorrow, death, and pain to any family.
Pastor Thompson, let me put you on pause. Dr. Elias, let me come back to you in our Kano studios because what Pastor Thompson has spoken about doesn't just apply to the Christian faith. In Islam as well, you've made references to some of the scriptures where you talked about the fact that people are supposed to listen to authorities, experts in various fields. But then there's also the aspect of faith. There are those who believe that those who really believe may have a different kind of solution to this, and that therefore some of those who are advocating that places of worship should be allowed to open do so from that perspective. What do you think? I mean, apart from being a cleric, you're also a scholar.
Yeah. So basically, I think this is a good development as far as I'm concerned, because at some point we have to acknowledge that COVID-19 is real. And if you are in doubt, you can ask someone living in Spain or in the United States, and they will tell you that it is real. From a historical footnote, we can see that COVID-19 made its way into Africa toward the end of February. But 3 months later, the figures, we have so far recorded well over 17,000 cases of COVID-19 with more than 450 deaths. So if anything, this goes to show that it's real. So to deny its existence is nothing but hope against evidence. And any person who is doing that, he is betting life of millions into a reckless gamble. And this is something which we must not take. So regardless of your faith affiliation, you must respect and strictly adhere to the advice of professionals in the field, like I said, doctors in this case. Number one. Number two, there are things related to lockdown itself. Lockdown, permit me to be brutally frank as possible, because it has caused serious social, economic, financial damages to many people. We have to acknowledge that what works in the United States might not be possible or suitable to Nigerians because half of population live, I think, below poverty line. So we must take a cognizance of that fact. Those people who are trying to go against the evidence or to reject the existence of COVID-19, basically their judgment may be fairly relative, may be fairly subjective. They're doing that possibly based on financial reasons, not because they don't believe that it is real, but because it has impeded them from going about their day-to-day routines. So Islam respects financial security. It respects humanity above all. So we, as much as we care to respect social distancing, spacing, and whatever, and anything that goes with COVID-19 and its challenges, we have to also respect the well-being, the financial security of our people, which is potentially more dangerous, way more dangerous than COVID-19 itself.
Okay, I'm going to take 1 minute and ask each of you in 20 seconds to tell me, should we continue to keep the places of worship closed right now? Yes or no? Dr. Elias?
Actually, it is yes. My answer is big yes, because we have been made to believe that places of worships are our ritual places to go closer to God. It is the place that we must to go to raise the level of our religiosity. So if now you ask us to stay away from those places, tell me, how can we get connected with God? So the best way to get connected with God religiously is to allow us to go over with our ritual activities and, more importantly, in places of worships.
Okay, let me put you on pause. Pastor Thompson.
Yes, interesting. For the Christian faith, the building where we aggregate to worship is useful. But for the Christian faith theologically, it is actually the body, the human temple, that is the place of worship when push comes to shove. And I think what is more important for us, because I was talking to the CAN president a few days ago, is this. It's not even just the pandemic that is the issue. He mentioned some things very important. I think it's the disruption, the COVID-19 disruption that is deadlier. And this is where religion comes in. I think we've called for a closer walk with the federal government. There's a need for a fusion so that we can talk about the major disruptions that are going on. America is not handling it well. They've broken all. Look, this COVID pandemic has brought the global industrial complex to a grinding halt. It has broken all economic rules. Everybody knows that life will never be the same by the time this thing is through. Not because of the pandemic, but the disruption. It's the disruption that's bringing desperation. Most people in Nigeria are off-grid when you come to look at the banking, financial instruments and all that. So there needs to be a lot more wisdom, a cooperation between religious authorities and the federal government to manage much better than talking about the pandemic. What we need to manage much better is the disruption that is coming in the wake of this pandemic, food security.
At that point, that's where we're going to have to leave it, Pastor Thompson. Thank you very much. Let me thank both Pastor Thompson and Dr. Elias in our Kano studios for their time this evening. This is a very sensitive subject and affecting quite a number of people. But thank you both for your time this evening. Still staying with the issue of religious places of worship, let's go now to the south-south region of the country, particularly in Bayelsa State, where as the number of coronavirus cases increases, the state government has issued fresh directives to religious bodies with the aim to curb the spread of the disease. It is now compulsory for places of worship to ensure that they provide alcohol-based hand sanitizers for use by their members. Our correspondent, Deborah Timiwood, has the details.
If residents of Bayelsa State thought that the reduction of the number of cases in Bayelsa that was experienced last week is a sign that they are winning the fight against coronavirus, then at Saturday, they really would know that they were wrong in their thinking. Because there are 111 confirmed cases of coronavirus in Bayelsa State at the moment. 80 active cases, 28 persons have recovered, and the state has recorded 3 deaths. Now, this is a worrisome trend in the state because as at yesterday, the state recorded 54 new cases. Today, Bayelsa State had 25 new cases. To curb the spread of the virus in the state, the governor of Bayelsa State has placed a ban on all midweek services at religious centers. He has also directed that on Sundays, worship should be between 7 a.m. and 1 p.m. We spoke with some religious leaders in the state on if they are adhering to the guidelines to curb the spread of the virus in Bayelsa State, and here's what they said.
We also encourage that infrared thermometers are made available so that the temperatures of the people are read while they are coming in. And anyone that has an alarming temperature, the attention of medical staff are called. We also encourage the churches to set up their own COVID-19 team within their church using medical personnel who are members of the church.
Let everybody that is coming to the mosque adhere by this instruction by coming to the masjid, to the mosque with the face mask. So without it, I think we also have to follow up to make sure that, yes, those who do not have it should be turned back so that they should know how serious it is.
We should keep to the rules and regulations. We should always keep that social distance like they told us, wash your hands and sanitize it. Always it is advisable that we should keep all those advice.
What is worrisome about these results is that these results are from samples taken from almost 1 month ago. That means if we look at it critically, the number of persons infected with coronavirus in Bayelsa State at the moment may far exceed 111 because there is an almost 4 weeks gap of samples that have not been tested. Now, the Bayelsa State government says it will do all it can to ensure that the curve of coronavirus in Bayelsa State is reduced to the barest minimum. From Yenegua, Dobra Timiwood for COVID-19 updates.
Now in Lagos, the nation's commercial capital, religious leaders appear to be in various positions as regards the state government's decision to suspend the reopening of worship centers. In our next piece, our correspondent Olu Phillips brings us the details of these perceptions.
I want to inform you that we will not be proceeding.
The distilled directive at the state level ordering the reopening of worship centers in Lagos has since been rescinded after an initial date of 19th for the Muslims and 21st for the Christian gatherings. That cancellation is already having some consequences. Rafatullah Mosque in Lagos have made preparations to improve hygiene in accordance to COVID preventions, but won't be meeting just yet and do not seem to have any qualms with the indefinite suspension.
We all call our members and tell them, just be patient and adhere by the rules and regulations given by the government. This is a trial from Almighty Allah, so you have to be very, very careful. You don't contact this disease as a result of your silliness. So remain at home and continue praying, be prayerful that Allah subhanahu wa ta'ala should take this away from us.
Although members of the faith-based community do have different perception to the guidelines, those who consented to reopening had their hopes dashed aside the intense arrangement made to keep worshippers safe in the auditoriums and outside the auditoriums.
It came like a shock, but nevertheless, we will not be insensitive. I think the government is being sensitive. Patience is required this time.
According to this clergy, the practice of faith does not exclude facts and realities. Therefore, there's no compromise in adhering to protective protocols even in the church.
You can be a spiritual leader
a leader of faith, and your faith can protect you. Your anointing can protect you, but that may not be applicable to all and sundry, because among your congregants you have people at different levels of faith.
The prayer dome of KICC went all out in anticipation of a reopening. They prepped,
you stand here and you do that, you say that's good,
organized, held several meetings, simulated what a service would be, but all of that went into the air. And the senior pastor has some deep thoughts about the entire outcomes.
in my opinion, this cannot be justified by science. The decision cannot be justified by any data. The decision cannot be justified by any occurrence.
Channels Television also reached out to members of the Orthodox Church leadership. Many of them declined having their positions on camera, however, indicating that they are willing to comply with the state government's directives and decisions. The numbers are spiking daily. The containments are begging for enforcement. Compensations for the undulated realities in lifestyle can only begin to happen when the curve is or begins to flatten. How soon that will be the case is a wait out time that continues to threaten already weary hearts. Olu Phillips, Channels Television News.
Of the over 100,000 COVID-19 samples tested in Nigeria so far, a total of 17,735 cases have been confirmed in the country. In the last 24 hours, 14 deaths have been recorded, putting the death toll at 469, while 5,967 people have recovered. The nation's total active cases therefore stands at 11,299. Now let's take a look at this issue of religious places of worship and now the medical argument. I'm being joined here in our studios by Dr. Adekemi Kiladejo. Thank you so much for coming in. Dr. Kiladejo is a public health physician. Now, you've listened to all the arguments from the various religious leaders about whether or not they're prepared or they should be prepared. What makes religious places of worship particularly susceptible in this situation?
Also, thank you for that question. I would say that the best way to answer your question is to analyze it from the public health perspective. Yeah. Exactly. For every pandemic or every public health challenge that we have, we must have structured models, structured modes of approach. In this case, in my own view, I personally think that one of the greatest stakeholders that we have in the fight against the COVID-19 pandemic are the religious leaders. Why? The reason is that Nigeria, like many other African nations, is a very religious setting. Most people are under some form of religious leaders, whether in a large church or a large mosque, or even the other religions. And the best way to pass information across to any group of people is to pass it through who they trust most. In our society, the groups of people trust most are, 1, their doctors, 2, their pastors or imams or some forms of traditional rulers. And so it is important for us to know that the highest form of engagement will not be complete without strategically involving them and engaging them actively to take ownership of the COVID-19, of the fight against COVID-19. Back to opening of religious places, that was just to form a background. It's multi-dimensional. When guidelines are put in place, there would also be enforcement of the guidelines. And so it might be rash to reach a conclusion so quick that every religious houses cannot meet up with the guidelines. There needs to be an assessment of each of those religious houses. And it's not far-fetched how this can be done. I know that they also have associations. And if you can engage, if government engages with the leaders of each of the strategic heads apart from the CAN chairman, for each local government, you have different associations for these religious settings. They can go into their worship centers to assess the preparedness to prevent the spread of COVID-19 vis-a-vis opening of the religious places. And so it's easy for anyone to think there is some bias if they have not been assessed, and then you just say don't open. In the fight against COVID-19, one of the very important things we need to start doing, which government has been doing, and I must commend the efforts of the federal, the state, and the local government, and every stakeholders that has been fighting against COVID-19. We're doing a lot, but we can still do more. In this fight, community engagement is the highest level of success we can achieve. Why? That's the only method that guarantees sustainability. Until we know that COVID-19 might be here for longer than we think, and we must learn to start living a new normal. That's the truth.
So many people talk about this new normal.
Yes, because absolutely in the past, we don't talk about putting on face masks in the public. If you see someone with a face mask, you're wondering, is this person normal? Or is this some form of masquerade? But now it's the new normal. And people have gotten used to it. Now we sew clothes to match our dresses and even to match our shoes. And so now we're no longer talking about the shoes that match our clothes. The females or the males are talking about the mask that matches their tie and all of that. Now that's the new normal. While making it interesting for us, we still must keep to the guidelines. We must also bear in mind that, according to the definition of health by the World Health Organization, it defines health as the complete state of, as a state of well-being, But it talks about the complete state of physical, mental, and social well-being. How do we assure the psychosocial well-being of the people? While preventing physical disease, it's important to know that these religious houses over the years have helped to fix the psychological well-being of people, the mental state. And for some religious settings, because of the level of poverty that leads, there's a connection between poverty, ignorance, and disease. Because of the high level of poverty in the land, what happens is that some people even get their daily meal from church, or from the mosque, or from some other forms of traditional homes. That aside, I said it was multifaceted, it was multidimensional. Going back to the side of the government, I want to believe that the government must have done a lot of reviews, especially the Lagos state government that came up to say, no, we plan to open. For them to have said we plan to, it means they had also done some assessment to say, oh, we think it will be beneficial to the people at this point in time. And for them to come back to say, no, not now. It also means, I listened to the governor, he said, based on some extensive reviews.
Right.
Maybe the leadership of these religious houses, maybe we owe them a little more information, because many of them have gone to prepare for this opening and reopening. They've invested a lot. Suffice to say that some might even have had to borrow funds to ensure that all of these things are in place. And now they're in debt. So we might need to give them a little more information about the reviews that were done and why we need to extend it a little more.
Dr. Kiladejo, thank you so much for your time. I wish we had more time to talk about this.
Yeah,
but in the coming days, definitely we will.
Yeah, absolutely. It's always nice to be here. Thank you for having me.
Thank you so much.
Yeah, thank you.
Let's go straight to the United Arab Emirates, where our correspondent, Mayowa Adegoke, is standing by. Good evening, Mayowa. Again, the UAE is unique in many respects. This time around, they seem to be having it on their plate to tackle this issue of coronavirus frontally. What can you tell us about that?
Good evening, Ladi. It's a pleasure to be back on. And yes, I've got good news from the UAE, Dubai, especially because they seem to be flattening the curve over here. Now, in a couple of past days, we've seen more recoveries than new cases, which has been consistent, and that's really exciting. Today alone, we had 704 recoveries as against 388 new cases, and that's been the trend. So we expect to continue to see this trend rise and improve. And of course, I believe that this might have informed a couple of government decisions. For instance, restrictions placed on the elderly, 60 and above, as well as children 12 and below, to go to the malls or participate in certain activities. That restriction has been lifted. A number of restrictions have been lifted already. Water sports, that's already, it's good to go. Water parks are now open, so everything pertaining to water recreation, all that, they've been giving go ahead to open up, of course, with guidelines in place, strict guidelines and sterilization programs put in place, as well as monitoring to ensure compliance. But the good news is things are really, really looking up over here.
That's good news, Maiwa, from that angle. Just before we wrap this up, it's going to be a quick one. Let me also ask you now, going forward, how soon can you predict that things will actually return to normal? Because the way people describe normal now is different. Going forward, how soon can you really predict now that things will return to normal? Other places are opening up. Dubai is also doing so. How fast do you think its tourism, for example, can return to speed?
Well, the government is putting a lot in place. And when we talk about normal, so things are actually quite normal over here, except for the fact that, you've got to wear your mask and maintain social distance. Aside from these, it's normal. And they're really putting a lot of campaigns in place to make sure that they're getting ready to welcome tourists. A lot is being put in place. There's still a bit of how would I put it? It's still not as fast when you say, oh, how soon can we have tourists come back? There's still, that may not happen anytime soon, because there's still a backlog of residents who are stuck outside. At the last stats I checked, they've got about 200,000 expats still stuck out of the UAE trying to get in, and the procedure is not that fast to come back because you've got to obtain a permit to come back. So in here, it's quite normal. But how fast can we have, outsiders come back? That may take a bit of a time still.
All right, thank you very much, Maiwa Adegoke, reporting there from Dubai in the United Arab Emirates. Thank you so much for your time.
Thank you very much.
New York City Mayor Bill de Blasio says the one-time epicenter of the coronavirus pandemic in the U.S. will enter its next phase of reopening on Monday. In this phase of its plan, hair salons, retail shops, and restaurants with outdoor dining areas will be allowed to reopen. The move puts the city on the path to economic recovery from the devastating impact of the coronavirus pandemic. So do take responsibility. That's the message from the NCDC. Take a look at their website. You have information, all kinds of things, how you as individuals, communities, and organizations can help prevent the further transmission of COVID-19. The WHO has similar information on its website, and of course, Channels Television at our website, channelstv.com, has updates of these and indeed all other stories of various shades and colors from around the world. I'm Ladi Akiridulwale. That's been COVID-19 Update tonight. Good night.